Hello, my name is Joel Thomas. I'm the CEO of Spin Global, a small business based in DC focused on disaster and emergency management. I'm here talking about the coronavirus, COVID-19, because I have tons of family, friends, colleagues, folks who I worship with asking lots of questions. So just on a personal note, this is an event that's quite near and dear to my life. My mother and 7 of my aunts and uncles and cousins were on the Princess cruise ship off the coast of California for the last 2 weeks. Fortunately, yesterday and today, they have all been moved to a quarantine state for the next 2 weeks at military bases around the country. In addition, my company is actually involved in the COVID response, both nationally with the U.S. government, here locally in the D.C. area, in the city of Fairfax, where we have a couple of cases. We're working to support them, as well as with other private sector companies and NGOs around the world. So I come at this as a disaster expert, not as a health expert. Certainly different points of view that can be reflected from different people in the world, depending on their field of expertise and experience. I would like to address some frequently asked questions and just give you some general perspective on COVID-19 based upon questions I've received and some insights that I have. So first of all, the question of pandemic. We have heard from both the Centers for Disease Control and the World Health Organization now that this is in fact a pandemic, but often there's some confusion. What is a pandemic? A pandemic simply is a widespread disease that's highly contagious and infectious, and that is a threat to our wellness and state of being. And so pandemic does not necessarily, the use of that term doesn't infer deadliness necessarily. Not all pandemics are equal. If you look at things like the coronavirus versus things like Ebola, we're talking about very different types of diseases that cause very different death rates. Certainly, coronavirus is a threat. It is worse of a threat than the flu. Just for some perspective, globally last year, about 600,000 people died from the flu, 60,000 in the U.S., 80,000 the year before. This represents about a 1%, of the people who got it that died. Coronavirus is a little bit higher, somewhere north of 3% to 6 or 7%, depending on which estimates you look at. But it's not Ebola. This is not Ebola, where it's 80 to 90% death rates. It shows as a common cold, a fever, similar symptoms, but it has a much longer incubation and duration period, 2 weeks or longer, actually, up to 20, 24 days. And so it's certainly something that is a threat, something we should be concerned about. It is highly contagious, and it's spreading worldwide in dozens of countries all over the world in a very short period of time. We're at the very beginning of coronavirus. You may see the news from CNN, or you might be looking at some of the maps online. Johns Hopkins has a great map where you see there's about 126,000 cases confirmed as of today globally, of which about 1,300 are in the United States, and have resulted in about 4,600 deaths. The good news is about 67,000 cases of those confirmed cases have been closed. People are over the coronavirus at this point, and that's been confirmed. So this is something that the majority of people in the world, majority of Americans, will survive. It's something that really is not deadly for kids at all, relatively. And if you're under age 50, you have a 0.4% chance or less of dying. So this is more of a disease. It's the new pandemic du jour. You may recall H1N1, 2009. We had a similar experience spread around the world. Today, nobody thinks about it, but just last year, we had tons of cases in the United States and around the world. So my belief, and I believe the belief of healthcare professionals around the world, is that coronavirus is part of the new normal. It's something that we're going to have to learn to live with for perhaps the remainder of our lives. There are others who think it might go away, but I think it's more probable, at least in the coming years, that 50% to 70% of the world may actually contract coronavirus, and that majority of people will live. There is one demographic that is most at risk, and those are the elderly. 1 in 6 elderly, age 65 or above, will die. I think the older you get, the higher the probabilities. And those who are vulnerable, already have pre-existing conditions. And so if folks are in that category, this is of a much more grave concern than for the rest of the general populace. So, and considering half the world's population is under 21, and a majority of the population in the world is under 50, I'd say majority of humanity should not be concerned for their lives based upon the coronavirus. I'll also add that while the infection rate is high right now, we're just seeing the tip of the iceberg. we're seeing numbers like 126,000 globally. Mark my words, this will be millions and potentially tens of millions in the coming years. I'm not sure how quickly we'll get there. It's likely for the next few months. This number is only going up and going to get higher. And so don't be alarmed when you see the numbers going up. This is contagious. So what is the appropriate response? And that's really the question I've been getting a lot lately. Should we be panicked? Should we be preventing? Should we self-quarantine? Should we eliminate all contact with humanity? What should I do from a household perspective, from a business perspective, from a house of worship perspective? I'm going to offer you some insights on each one of those things. So from a basic 101, how do you deal with coronavirus? It's basic hygiene, folks. Wash your hands. If you're sick, stay away from folks. Practice some social distancing as necessary. And basically, by doing so, you're going to probably prevent yourself not only from getting coronavirus, but some of the other common things right now, which it is still flu season. So it might actually have some other benefits by paying a special attention to your hygiene and to those around you. Washing doorknobs. Doorknobs are filthy. Money. Gas stations where we go, be sure to just wash your hands after going to high volume areas, opening doors to public spaces. These are times when you want to think about paying a special attention to washing your hands. If you just returned from public transit, I just returned from a few countries overseas this last weekend, washing my hands the entire time I'm there and when I come back. So that's the starting point. As it relates to quarantine, this is a big discussion. Should we quarantine or not? And right now you're seeing around the country some certain hotbeds. And you're seeing in the world, even in Italy, where you've got a nation that's actually got a national quarantine and shutdown on schools, businesses, asking people to stay at home. You have cities like in Washington, D.C., we had an Episcopal priest who is confirmed with coronavirus but had not traveled. So this was a case of community spread coronavirus. So the mayor just this week asked everybody in that church in Georgetown to self-quarantine, a few hundred people to keep the spread of that virus from happening. There's others who are saying, hey, don't attend large events larger than 1,000. If you have an event larger than 1,000, cancel it. And it's a good time to do that. I'll say this, there's 2 points of view on this. There's the healthcare perspective, and then there's the consequence management perspective. If you ask a doctor, how do you prevent the spread of an illness? They're going to tell you, first take care of yourself, and then quarantine. That's the natural answer. But we have to think about in advance before we go down this road too far. At what point will we draw ourselves out of quarantine? And so if we're going to stop engaging with society in certain ways, at what point will we begin to do that? And I think it's problematic, and I'm actually not quite as comfortable with the rhetoric that's out there. And I think listening to health officials driving this response, they're always going to err on the side of quarantine and things like that. I think from a consequence management standpoint, we have to think about this simple equation. Risk equals threat times consequence times probability. Now, we have a real threat in coronavirus. It's a pandemic, period. The consequences are most people will get a cold and a fever and flu-like symptoms and get over it. The probability for Americans at this point is very low at present. That could change over time, but at present, we're talking hundreds of people, 1,300 who have confirmed cases, although let's say that's even 10 times or 100 times the number that actually have at this point. Still, the probability is pretty low for the average American in terms of contracting this disease in the near term. I do believe, as I said earlier, this is something that everybody should expect that you might get in the course of your lifetime. But I think that we should not significantly alter our way of life at this point, unless there's cause to. If you are in a hotbed community, where it's a higher risk, where there's lots of people who have it, or if you know somebody who has had it in your workplace, these are causes for social distancing and potentially some quarantine. But for the average person right now in America, we should continue business as usual, and we should be more prudent. We should change our habits, be more prudent, be careful about touching our eyes and nose and mouth, and washing our hands. Be careful about when we greet people, being careful to wash our hands. But we shouldn't stop living. The problem with the approach right now is people are reacting out of fear, as opposed to the reality that we need to learn to live with risk every day. And I think the reality of the pandemic is showing us the vulnerability we have, but the reality is we actually have vulnerability to earthquakes, fires, floods, hurricanes, terrorist threats. There's all sorts of hazards and threats that are looming, and and including things like car accidents and other diseases that you can contract that are statistically much more probable to happen to most people in America over the next 3 months than coronavirus, in my opinion. And so I think that we need to be careful when we look from a consequence management standpoint at how we're adjusting our lives and whether it's sustainable or not. So if you're thinking about self-quarantining, if you're able to work from home, great, good for you. It might not be a bad idea. And if your employer allows for that, it's great. A lot of folks are unable to do that. And for Main Street America, this is going to crush small businesses. Let's think about the consequence to businesses by not participating in normal activity. Small businesses make up 99% of America, the American economy. 45% of Americans are employed by small businesses. If we stop patronizing the small businesses, they will fail. 3 days of business closure for the average small business in a disaster will result in failure. And so we need to consider, what does failure mean for that small business? It means that people will be without jobs and work and unable to pay rent or mortgages or bills. And this will cause actually the unintended consequence of overreacting is actually causing significant harm, not just to our economy in the macro theoretical level, but to actually human beings who are going to have to live with the consequences of those realities. So I'd encourage you, get out there, go visit small businesses, patronize them, go to restaurants and go shopping and do the things. Just be prudent when you're doing it. Be careful and be cautious and take extra caution every step of the way. But frankly, in one way, not necessarily more than we should anyways. I think we just need to probably self-correct a little bit towards hygiene, perhaps more than we're accustomed to. So the other piece of this is that while small businesses represent a huge source of the economic reality in our country, large businesses do as well. So 1% of our country employs about 55% of Americans. And these companies have huge consequence in terms of canceling large events, etc. Now there's been guidance out there, and I will say CDC, the Center for Disease Control, and the World Health Organization, Federal Emergency Management Agency, and your local health authorities are the official authoritative voices. Listen to your governors, listen to your mayors. If they ask you to quarantine, I advise paying attention to them. Many people are asking not to participate in large events or to travel. That is a good preventative message, and I think it does suppress the spread of this disease. But I think the genie has left the bottle, and I think there's no way to put the genie back in the bottle, and I think we need to be prepared for the reality that even in spite of these actions, this coronavirus is going to spread, and much more than it already has at this point. We need to be prepared for millions, not thousands, of people having this. And so where that leads me to is, at what point am I going to re-engage society if I pull out now? It's not going to be any time in the next few months. And is that sustainable? So we need to be pragmatic here. I think we need to really have a level head and think about, actually we need to continue to engage society in the normal ways that we do and just be more prudent. So that's my message to America. That's my message to people in the world. Not in any way minimizing the reality of the threat, but looking at the probability and consequence of this disease. I think it'd be much more prudent to live your life the normal way that you do, and take some extra precautions. And so I'd like to talk about that. What can you do right now to prepare for some of the eventualities of coronavirus? In addition to your personal health and hygiene, I think it's a good time to think about preparing to be quarantined if asked. Your governor, your mayor may ask you to self-quarantine for 2 weeks, a month, whatever. And I think we need to be prepared to have enough food and water, medical prescriptions, and cash to survive. There's cheap ways to do this. Bags of rice, beans, tuna are very inexpensive ways to purchase supplies that can last weeks and feed us. Most of humanity lives on rice and beans diet every day. I know in America that's not the commonplace, but we can get by. So I think we do need to prepare for that eventuality, and I think now's the time to do it. And I think most Americans, according to household surveys, don't have $500 to spare cash on hand for a disaster. Now's the time to cut frivolous expenses and actually stock up some cash and have that on hand and make sure that you're able to withstand the potential disruption. The president and Congress are looking at some cuts to payroll taxes. I don't think that's going to be enough for most Americans. I think unless we get some significant relief beyond that, there's going to be a cash shortfall that people experience from either not being able to be employed, businesses not making profits, and the downstream trickle effects from that. So, in addition, stay calm. Don't help with spreading the paranoia around this. I would say some have said, is this a coronavirus, coronaphobia? And I'd say, no, this is not coronaphobia. That's going too far. This is a real threat. But this is not Ebola, right? So somewhere in the middle, there is living with risk every day. How do we learn to live with risk? In confidence, not being motivated out of fear, not promoting fear, but caring for those around us. So I think one of the most important things we can do is evaluate who's in our life and how can we care for them. How do we care for our family, our friends, our neighbors, especially the vulnerable and the elderly? Now, of all the things I'm saying, if there's extra caution to take, it's for the vulnerable and the elderly. Make sure, I'd say those people especially should self-quarantine, avoid large crowds, all the things that people are being advised not to do. I would say those demographics especially should pay attention, and if you know people in those demographics, pay attention to them. Because at the same time, while self-quarantine may be advisable or staying out of social gatherings, there's also psychological problems with loneliness, and we don't want to contribute to mental health challenges for folks being quarantined. I can tell you from personal experience, my mother and family members have been on a ship and now quarantined for a couple weeks. It's maddening. And if you talk to them, it's maddening. But keeping in touch through technology, phone calls, you can be in touch in many ways nowadays with modern technology. I think we can actually help people sort of live through this process. So stay calm, be informed, care for your friends, family. For your personal life, assess your own risk exposure. Look at your daily life habits. Look at the exposure to this disease and consider what you can do to be more prudent. I would say don't withdraw from society, but find ways to interact with society. I think I'm a small business owner. I've actually created some guidance that's been published and shared with thousands of CEOs nationally and through City of Fairfax and others. And if you're a business owner, I've got a sort of a top 10 list for businesses, what you can do, which quickly care for your employees, assess the resiliency of your company, assess your corporate policies, review your plans and start testing them today. Review and diversify your supply chain dependencies, look at your insurance coverages and healthcare benefits, stay informed, maintain consistent communications with your employees, and if you do have the unfortunate reality of having to close your business, consult counsel on how to do that properly. I will say, with regard to those, I do have an extensive fact sheet, FAQ sheet, if anybody wants to learn more. But I do want to comment for a few minutes on houses of worship. Houses of worship are a particularly interesting body of folks that there's a lot of questions about how to handle it. There are pastors who are concerned. They don't want to be the cause for their congregants to get exposed and die. They certainly don't want to cause harm to the people they're caring for. And so the question of, do I keep my church open or my synagogue open, or do I keep it closed? Do I close it temporarily? And again, the question comes to not just what you should do now, but what are you going to do later, and what's the trigger for closure now or later? What's the trigger for certain courses of action now or later? I would say, at a minimum, communicate with your parishioners. Communicate with the folks who are attending your house of worship, and encourage them. Share the messages that are being sent from the Centers for Disease Control. CDC actually has a house of worship, some guidance for houses of worship. Care for the elderly and the vulnerable. Some are going as far as to say we don't want children or their families in church. I'd say that's not advisable. There's no reason to do that. Children aren't dying from this. Children aren't carrying this disease. If your child has a fever, if your child is sick, keep them home. Don't take them to the house of worship. But I wouldn't preclude families from joining houses of worship in this time when people need comfort and care. I would say in these mass gatherings, we should be careful. You might want to avoid the holy kiss. You might want to stay away from too close of affection, or if you're going to shake hands and hug, just be mindful and be careful to wash up after. A lot of folks have talked about masks. The Surgeon General has advised that masks do not prevent the spread of coronavirus. At the same time, if people are sick and they're coughing everywhere, some people feel more comfortable with a mask. So make your own decision on that, but I'll just say that occupational safety folks need those masks, so stop buying them. The Surgeon General said it, I'll say it, stop buying masks. They don't help. Just really what you need is soap and some common sense. So from a house of worship standpoint, I would send messages to the families in the church or the synagogue or house of worship. Advise children, have opportunities for kids if they're in a class to wash frequently and before, during, and after class. before, during, and after snacks. I think if you're taking communion, it's a tricky one. There are some traditional churches where people will dip bread in the wine. That's actually the least healthy option because your fingers get in there. Some will drink from the same chalice, and then there's others that have little portable sort of communion and hosts, right? Sort of bread and wine if you're in a church. And so I would say look for the option that makes people most comfortable. We want church and houses of worship to be a safe place. So I'd say find ways to make it a safe place for people, and advise people of the risks of sharing common glass or food. I think there's also questions about buffets and potlucks. What should we do there? You might consider having servers at those buffets and potlucks who wear gloves. That's a way you can still have a buffet and a potluck and have a community meal, but actually have somebody serving it. They did this on my mother's cruise ship. Instead of people serving, once coronavirus was announced, they had servers with gloves. Unfortunately, a lot of those servers had coronavirus. That's a side note. But the moral of the story is care for yourself, be prudent, be diligent. This isn't a time to freak out. I actually think things are going to get way worse. If you're really afraid and scared now, it's only going to get worse. But the good news is, this isn't that deadly of a disease relative to for the majority of the population. It is 6 to 10 times more deadly than the flu. The flu killed 600,000 last year. We may have a lot more deaths, and I loathe the fact that we would have any deaths result from this. And some might view my perspective as dismissive and saying that by not encouraging people to be playing the maximum quarantine game, that you're causing other people to die. I think that's a farce. I think that people, if they are vulnerable or elderly and get sick, there's lots of complications and causes for death, and I don't think that any of us should take responsibility upon our own shoulders like that, or be able to point the finger at somebody and make this a blame game and become judgmental of one another for actions. I do think it is important that society gets back to normal. It is important that we travel. It is important that we go to work. I would even suggest being in a large gathering is acceptable if you're taking precautions. That might be a time where taking some extra precautions would be advisable beyond the norm. But those are some of the initial comments I have. I've got my wife here on the other end, hearing what I'm saying, and I'll ask her, are there any other questions you think that folks may have that you'd like to hear me address?
Yeah, I think one question is, it's so hard to know whether or not you've been exposed, right? So how do you deal with that? How do you deal with the uncertainty of whether you are a carrier unknowingly into your community, and that influencing your decision to quarantine or not?
No, that's a great question, Laura. There's a chart that I can share with anybody who's interested. Email info@spinglobal.co. It shows the difference between coronavirus, flu, and the common cold, and the different symptoms, and when you should go to the doctor and inquire about it. It's a very helpful starting point to sort of self-diagnose. Once you get to that point, there are tests that are being developed. The government created a bunch of tests and made them available in state health facilities. And then one of the greatest examples of private-public partnerships in the history of mankind is when the White House engaged with LabCorp and Quest and got their agreement and concurrence to develop 1 million tests this week, 4 million next week, etc. The reality is it's going to take time for those to be distributed. Even when those tests get distributed, by the way, my mother, who's been on this ship, the coronavirus ship, and has known about this since last Tuesday. It's now what's today? Wednesday, February 10th or 11th. March 11th. She has not been tested yet. So there's supply chain problems. So only the people who have symptoms of coronavirus or who have other complications have been tested. My mother, who's on that ship that everybody's paying attention to in the world, that has 2,500 passengers, she has not been tested yet. So I think the reality is it's going to take a while for people in the commonplace to have availability and accessibility to test, to know definitively. I think we don't need to know definitively necessarily to know what to do and how to handle it. There are basic precautions we can take and basic guidance we can do when you're sick. When you're sick, stay quarantined, get rest, stay hydrated. You can take over-the-counter medicines as needed, and you can also ask your local primary care doctor or urgent care doctor for any additional guidance as needed. So I'd say that it's likely for the several weeks, coming months, that many people won't be able to know definitively whether they have it. There are tests around the country. There are shortages and stopgaps in even processing those tests, which actually take about 4 hours to get results from, but it's taking days for people to get the results because of the backlog that exists in the country nationally right now. Great question. Any other questions?
Yes. So some people, one of their fears might be that if so many people get this, if there are hundreds and thousands of people getting this and need hospital care, what if the hospitals are too full? And from a disaster perspective, I wondered if you could speak into that.
That's a great point. I think one of the more significant concerns of multiple people getting coronavirus isn't necessarily death caused by coronavirus. It's the stress on the healthcare systems and the hospitals in our country. We're already seeing that right now in some communities around the country, on the West Coast, and related to this ship, the Princess cruise ship that is now on shore. And seeing the stress that's causing. My own mother hasn't been able to get a hold of a healthcare professional. She didn't even get a couple meals delivered a few times. I mean, so there's stress and logistical coordination challenges, and basically they're triaging. Who really needs help? Who's, it's basically who's walking, who's limping, and who's dead, right? And so the people who are near death or dying are going to be treated first. Those who are limping are going to be treated second. Those who are walking are going to be treated last. So if you find yourself walking, just get ready for the wait. If you're in a situation where it's dire, I think the reality is there's normal traffic in the healthcare system and in 911 calls and car accidents and everything else going on in life, and this does cause concern. And so someone is ultimately, if there's only a certain number of beds in a hospital and there's X number of people greater than the number of beds that need assistance, there's going to be a wait, and that could result in additional consequences, sickness, complications, or casualties. And so that is of great concern, and that is a cause for, and one of the main reasons why I think people are trying to prevent and suppress the spread of this disease, just to slow it down and give us time to get our systems catch up, have tests be developed, give time for vaccines to be developed, which are going to be a very long road from now, long distance from now. But if we can buy time, the idea is that we'll be able to manage this more efficiently. Great question. Any other questions for the general public?
I guess another question is about those two population groups that you mentioned, the elderly and the vulnerable. So what do you think that those of us who have elderly relatives or neighbors can do to assist them during this time? Many of them may not have access to the kind of knowledge that we're all getting. Many may not have access to proper medical care without assistance. Many may be interacting with people without as much knowledge or awareness. So what are your insights about caring for the elderly in our communities?
No, that's a fantastic question. First, caring for them is what you can do. First, let them make a list of the people in your life, your neighbors, your relatives, your friends, your colleagues, people at your church, wherever they are. Think about who they are, and then reach out to them. Check on them, see how they're doing, and then reach out again. Don't just reach out once, follow up again. Check on how they're doing. I think it's important, especially because those who are aware may already be practicing some social distancing. They may get lonely. And so I think it's important for people. There's a lot of research and science about the ability to be resilient in disasters, and being socially connected is one of those key ingredients. And so we don't want the unintended consequence of social distancing to be social disconnectedness, because that actually results in harsher consequences if and when something does happen. So stay connected. And inform them. Be an ambassador of information. Be an ambassador of peace. Be an ambassador of calm. And make sure that they've got basic supplies on hand. Help them think through what their needs are for the coming month. And then a month from now, do it again. Make sure they've got enough food, medical, prescriptions, and cash on hand to withstand whatever is to come our way, especially the case where we could be asked by our government to self-quarantine for an extended period of time.
Okay. And what about that other community, the vulnerable? Who would be involved in that community? I mean, who would be included in that? I know I've had friends who have asthma or have, a proclivity toward respiratory illnesses. So who would be involved or included in that grouping?
Yeah, I look at it in a couple ways. I look at it in terms of health vulnerabilities, social vulnerabilities, economic vulnerabilities. I think that from a social standpoint, folks who are disconnected, from an economic standpoint, folks who are going to lose their jobs or have less work available, who maybe work for hire or hourly part-time employees, folks who have a family and have one primary breadwinner in the household. I think those would be vulnerable if they're unable to work from remotely, and either business is slow and shifts are being cut, or business is closed altogether. I think then, of course, the health, what you mentioned, those who have pre-existing conditions, whether it be heart. There's a list on the CDC website of the significant ones, but yeah, you mentioned respiratory and asthma. These are concerns. I think folks who have pre-existing conditions should fall into the category of those who should do a little bit more social distancing than others, and should practice a little bit more quarantining than others. So quarantine, I think it's too far, actually. I think social distancing is the right word for those. But quarantining, especially if we get to a point where this community becomes a hotbed, and I'm talking Washington D.C. here, where I live, but any community where you live. So that's how I would address that.
And at what point would you say? Now I don't know what the experts are saying here, but at what point would you say about people re-engaging with society? I mean, if we're talking about a quarantine of a month, like you said, when does that begin and when does that end? How are we as a country? What have you heard anyway in your line of work about what their thoughts are, the leaders of our country, the plan in moving people back into society?
We have pandemic playbooks.
Okay.
We have pandemic plans. We've had them for decades. We have plans for how to disembark people from ships and deal with this exact situation. And unfortunately, my opinion is that healthcare officials are leading the narrative on this. And I think healthcare officials are the right people to tell us about the severity of the threat and the nature of the threat. But I think consequence managers, emergency managers, would be better suited to be the people running and managing the narrative here. We have a national response framework for how to handle these things. So there are plans and frameworks in place. Now I'll say this. Some of that's being ignored entirely, and there's rages of emotion that are leading this. And in other cases, I think there's quite a bit of deliberation and discussion about this. And I do anticipate, with the president's authorizing of aid for this, and I do anticipate emergency managers writ large getting more involved in this to look at the consequence management side of things. So what I'll say is this. If you're going to make a plan to social distance and quarantine, have a plan of when you're going to come out. And I think that's got to be part of it. There's got to be triggers on both ends. Otherwise, we're going to find ourselves in an incessant quarantine. If you're quarantining now, there's no reason why you should come back out of quarantine, at least until the summer, when this thing starts to slow down, in my opinion. There's no rationale for it. That's why I actually think it's too soon for the majority of people to quarantine. I think if a governor or a mayor asks you to quarantine, I'd say listen to your local authorities. Take their requests seriously. The reality is there's 3 million first responders in a country of 350 million. There's about 1 million police. This isn't something that's not going to be enforced like martial law, people keeping you in your home. It'll be very much a request, a self-imposed request if and when that does happen. But did I answer fully your question? Or did I miss part? I feel like I missed part of it.
No, it's and I think the other question, I know this might sound silly, but if I'm thinking it, I'm sure some people are, is what does quarantining really look like? I mean, does that mean you stay only in your house, you never leave your house? Does it mean you don't go to large places? I mean, I'm sure there are different levels of quarantine, but I'm just curious if there is a definition on the CDC website or other places of what, when you're requested by a mayor or a local authority to quarantine, what that actually calls for.
Yeah, so it essentially think social distancing. It doesn't have to be indoors. It can be also outdoors. You can, if you're going to be outdoors, be in open spaces. The idea is just to keep a distance from people, from other humans, as much as possible, or to a limited subset of humans that are all together. It means not going out, doing the normal chores that you do in life, getting food, getting groceries, getting gas, going shopping, going to the movies, means stay at home, rent a Netflix, eat the food that you have, use the water that you have on hand. So that's why you need to have stuff at home that you can manage, or on your property. But it does not mean you have to stay in your bedroom the entire time. It just means social distancing. If you have a car, you can drive out to the country and go see things. But I think just make sure you've got enough gas to get back. On the same trip, I think is the idea. They wouldn't want you. I think a quarantine would be, advising you to not
gas stations.
not going to the gas station. So
Right.
it doesn't mean that you can't move and can't exist. It just means keep social distance.
Okay.
Great questions.
I think that's all that I have.
Yeah. So with that, again, 67,000 of the 125,000 confirmed cases have already reported that they've overcome, and that's that's a rolling number, and 4,600 that have died, and those were mostly elderly and people with vulnerable pre-existing conditions. And so I'll say coronavirus is a real threat, but again, I go back to my equation: the risk in your life equals threat times consequence times probability. Right now, probability is very low, relatively low, but it's likely that in the course of the next few years, this will spread. My final message is learn to live with risk every day. Take this as an opportunity to be prepared and plan for the eventuality of any disaster that would cause you, whether it be a power outage, an extended power outage that would cause you to have to be at home and figure out how to live your life without access maybe to communications or your credit card, things like that. So I think take this as an opportunity to make your home more resilient, do an assessment of your business, do an assessment of your congregation, communicate frequently. If you're a business owner or a house of worship, communicate to your constituents as much as possible. Set the standard of care at or above what makes people feel safe. Don't overreact. Don't overcompensate. Keep the normalcy of your life as much as possible. And if we do get to a point where it is actually advisable in Washington D.C. to quarantine, I'll create another video and I'll tell people it's time to stop playing around. We're nowhere near that point right now. So
Okay.
I'll leave you with that.
All right. And if people have more questions, where should they
Yeah,
go?
so a couple things. If you want to build a plan, if you want to watch a video on pandemics, you can go to planetready.com. You can also go to planetready.com/train or planetready.com/plan. We actually have individual, family, house of worship, and business plans, 4 steps on what to do in the case of a pandemic. You can go there. You can also email info at spinglobal, S-P-I-N, global.co, and my team will get back to you. And happy to answer any questions. So thanks for your time, folks. I hope this was useful. If you have any questions, send us a note, and I'm happy to address those in a future message. Thank you.